Hi folks, welcome to the latest community conversation here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health, and today I am pleased to be joined by Dr. Elkin Nunez. He is the Director of Endocrinology at Atlantic Health System's Morristown Medical Center, and he is deeply involved in a lot of the diabetes education we do here across Atlantic Health System. So Doctor, thanks so much for joining us today, and we're looking forward to talking to you.
Thank you for the invitation, Lucas.
So we have a pretty cool topic today. It's one that crosses all kinds of socioeconomic boundaries, all kinds of age boundaries, all kinds of basically everything that might be used to separate people into different groups. This kind of crosses over all of them. We're talking about diabetes health, specifically the effect of diabetes on individuals, and really as it relates to what we're seeing in the holiday season, a lot of the challenges that come with maintaining a healthy diet and making healthy decisions, Thanksgiving, Christmas, all those times, they can be pretty challenging for folks, huh?
Very challenging, very challenging.
So just to give folks a little bit of background on how this will work, our community conversations work like this. The doctor and I will chat for a little bit, but this is very much an opportunity for you to participate as well. If you have a question about the topic we're discussing, or perhaps something closely related, you can add it into the comments section on the window below, and then we will try to get to those as quickly as we can. We have a team of folks who are helping coordinate that. If it's a question that's specifically tied to what we're talking about, we'll try to ask it, because other folks may have the same questions you do. Maybe they just don't, they're not brave enough to enter it in. If you miss any portion of this program, the entire thing will be available on our Facebook pages, but also on LinkedIn, on our website, atlantichealth.org. You can find an audio version of it on our SoundCloud account. And if maybe the internet isn't so much your thing all the time, but you'd rather watch it on TV, tune in to News 12 Plus Saturdays and Sundays from 8:30 to 9. You'll be able to see the whole thing there. So that is the community conversations. And Doctor,
well, now I'm famous.
Yes.
I'm famous now.
You are.
My children said, "Dad, now you've made it."
Now that you've been on a community conversation,
That's right.
you're going to get stopped in the street. I mean, there's nothing I can. Celebrity has its prices. Okay, so November is American Diabetes Month.
Yes.
This coming Saturday, and for those who may not be watching this live, this will be Saturday, November 14th, is World Diabetes Day. So it's really timely and appropriate that we're having this discussion right now. But I want to just kind of take a step back, because I can't assume that everybody who's watching this is totally familiar with diabetes and knows about the different types and the way it affects folks. Can you give us just a little bit of a primer, a 101, if you will, on diabetes?
Absolutely. We basically divide diabetes into two types, type 1 and type 2. Type 1 diabetes is where your pancreas does not make any insulin whatsoever. Maybe a tiny bit, but usually it doesn't make any, and you require insulin. When you have type 2 diabetes, which is usually about 95% of all of diabetes,
Is type 2 diabetes?
Type 2 diabetes. You make insulin, you just don't make enough of it. Your body can utilize it, and there's insulin resistance. So that's a big distinction.
Okay.
In type 2, you don't make enough of it. There's resistance to that insulin, and you can't utilize it the way you're supposed to. And so insulin is supposed to get into cells, or allow to connect to cells so the sugar can go into those cells. And without that insulin, can't happen. Glucose, sugar starts to accumulate in the bloodstream, and it keeps going up until you end up with symptoms.
Now, there are sort of strata to that, right? I'm sure there's varying degrees. We even have something that some folks may have heard of called prediabetes, where
Yes.
you may be sort of encroaching on diabetes, but not quite being diabetic yet. What is prediabetes?
So that's the patient who goes to their primary care doctor or gets blood work done for whatever reason. And the blood sugar is somewhere between 100 and 125 milligrams per deciliter. So normal blood sugar in the fasting state, first thing in the morning, you haven't eaten anything since 10 o'clock the night before, should be under 99. Okay. And if you're somewhere between 100 and 125, you have prediabetes. The other thing that we like to use to measure that is something called the A1C. Every person with diabetes, out there should know what the A1C is. And that's a percent number that equals the average blood sugar over the last 3 months. Normal A1C, when you don't have diabetes, it's less than 5.6, but when you have diabetes, it's 6.5 or greater. So we use both the regular blood sugar that we get from your blood test with the A1C to kind of gauge a person's broader and metabolic risk of either having prediabetes or diabetes. The pre-diabetes classification is if the A1C is between 5.7. Remember I said less than 5.6 is normal. 5.7 and 6.4, that's pre-diabetes.
If you're pre-diabetic,
by the way, there's 23 million people in the United States with pre-diabetes.
23
million.
And I saw from the American Diabetes Association that there are 34 million people who have diabetes.
That's right.
So you're talking almost 60 million people here. If you're pre-diabetic, is it like a lock that you'll become diabetic? Does one automatically lead to the other?
No, and that's the key. And that's why it's so vital to identify these patients and know, because if we know that from the diabetes prevention trials that have been done, if you incorporate total life changes, medical nutrition therapy, exercise, and some weight loss, we can prevent diabetes by as much as 58%.
Wow. That's a huge percentage.
So it's critical that all these people that have that kind of blood sugar, my biggest pet peeve is when a patient comes to me for the first time and says, oh yeah, my blood sugar was slightly elevated about 3 or 4 years ago. And I say, slightly elevated, what is that? Oh, I remember the doctor or my nurse practitioner saying it was about 102, 103, but they said, just watch it. And I tell them, watch what? You becoming diabetic?
You're in
or somebody with diabetes? You're eventually going to progress to diabetes, if you don't make the necessary changes in lifestyle so that we can mitigate the diabetes.
Now that's a perfect transition into our broader conversation today. And before we get into it, I want to talk a little bit about this concept of lifestyle changes, because are we talking about, some folks I know have made major changes to their diets. They've become vegetarian, or they changed what they're consuming. When you say lifestyle changes or total lifestyle changes, how broad does that go? How much of your life does that touch, do you say?
So, we used to tell patients, I remember when I was a medical student and an intern, we used to tell patients, you can't eat rice, you can't eat potatoes, you can't.
Like total.
You got to stop it, otherwise you become diabetic. We used to even threaten patients with that. And now we know, just from research and the studies that we've done, that all it takes is just moderation. I tell my patients, nobody should be telling you, even your primary care, I'll go out on a limb, nobody should be telling you can't do what you want to do. But if you can't control yourself, you should maybe not do it.
That's good advice.
So it's all moderation.
In a lot of different areas of your life, that's good advice.
No.
So I wonder then, as we turn to our discussion about the holidays, I would think, just based on my cursory knowledge of what the food selections usually are around the holidays, and based on what we've just talked about, that this is a particularly challenging time for people who are either pre-diabetic or who have diabetes. Is that true? Is this why November basically is the awareness month for this disease? Tell us a little bit about that.
Correct. So when patients come in, and I revert back to my patients because this is what I do, I tell them, because almost invariably, probably after about middle of January when they all start coming back, most patients, 70% of them, have gained some weight, 5 to 10 pounds. Yeah. And it always goes back to not one holiday, right? The problem with us as human beings and creatures of habit and what we do is that we have Halloween, one day. We have Thanksgiving, one day. New Year's or Christmas, one day. New Year's, one day. But we make it a month worth of a celebration. And so when
work parties or different family gatherings, it's always something.
Food at work, everywhere you go there's food, everybody's being friendly, everybody's being happy. Sure. We want to translate that into food, right? We're human beings. And so you end up gaining 5 to 10, sometimes even more. And then you got to kind of undo that at the beginning of the year. And so I'd like to put really, everybody that's got diabetes or pre-diabetes, you need to put yourself at the top of this year's list. And you really have to just worry about your health first and then everybody else's. Because if you get sick, if your diabetes gets out of control, it's everybody else's disease as well, not just your personal disease, right? You get sick and you get hospitalized, you're not the only one there. Your family's worried, everybody in the family's worried.
It cascades throughout the rest of the
Cascades, sorry.
What if you have a member of your family who has type 1 or type 2 diabetes, and you're responsible for planning a Thanksgiving meal or however, and we'll say this, folks, certainly with the holidays, it's an unprecedented time of year. It's an unprecedented year for this time of year to be entering into it. And so hopefully folks, as they're thinking about what they're going to do this holiday season, that they make a plan. Remember the most important things that we've been talking about all throughout the COVID-19 pandemic: mask wearing, hand washing, social distancing.
That's right.
Please incorporate those into whatever it is you have planned this holiday season, because those are the most important steps. But if you are a parent or an aunt or an uncle and you're planning whatever the meal is for folks, what are some things that people who are living with people who are diabetic or who may have recently been diagnosed as diabetic, what are some things they need to keep in mind to help the loved ones in their lives make those good decisions to get through the holiday season?
Well, you said it. Number one, I think it's limit the number of free carbs, simple sugars, things like candy and cakes and pies. Even though it's Thanksgiving, right? We love apple pie and all, sure. But you've got to limit those things. And I usually tell patients, look, when you get into the room where you're going to be, look at the food if it's already out, right? And scout, make a plan, mental plan. What am I going to go for? What am I going to consume? What should I consume? And then stick to that plan. Because what we tend to do is then walk around and start picking, right? And grazing. And you want to limit that grazing because the calories add up.
How do you know? Like, where do you go for information? I know our website, atlantichealth.org, is obviously a great one, but what are some, I know you're involved in a lot of education around diabetes for patients. What do you advise for patients to learn about the things they need to do?
So number one, if you're somebody that lives with diabetes and you've never seen a diabetes educator, then that's the first thing that they should be doing, right? A diabetes education professional is key, because they will teach you everything from what the goals are in terms of A1C, blood glucose for the days. They'll help you manage your control or teach you about your medications and how they interact with the other medications, and teach you about what it is that we're trying to prevent, right? The microvascular complications of diabetes, the macrovascular complications of diabetes. And so that's number one. So you would go to your primary care provider or your advanced practice provider and say, I've never had diabetes, or it's been 5 years since I had diabetes education. Can you please give me an order so that I can go see an educator? And if they're part of our system at Atlantic Health, they put in education through our electronic medical record, and it goes straight to a education hub. And no matter where you are, whether you're in Hackettstown, New Jersey, if you're in Newton, Overlook, somebody will contact you, and you'll be directed to the Prospective Education Center.
Now, I also want to mention, too, for those in the Morristown area, for World Diabetes Day, which we mentioned, is coming up on the 14th. There is an educational virtual seminar that I believe is happening this weekend, so folks can definitely check that out. And a lot of our information can be found at atlantichealth.org. There's like a text bar right there in the middle of the webpage, and you can enter in diabetes, you can search for things that you're interested in. That's a great resource for folks who are looking for information. We only have a couple minutes left, but I want to touch on something that is obviously a huge issue right now. The American Diabetes Association's website said, some information I found there suggested that of the 40% of individuals in America who have died from COVID-19, 40% of those individuals who have died were living with diabetes. So I think that the messages that we're talking about today would seem to me to be particularly significant with everything that's going on in our country right now.
Absolutely. We don't know quite specifically why the mortality rate in people with diabetes is so high, but we know that COVID-19 induces an inflammatory response throughout the whole body. Whether you have diabetes or no diabetes, but it just so happens that people with diabetes, that response gets more heightened and causes more problems. And so people with diabetes tend to be in the ICU longer, tend to have a longer length of stay in the hospital, have more complications and more death. So
look, I think that folks, right there, as we continue this series of community conversations, and we try to bring you information that you can put to good use to play an active role in your own health and well-being, It's that kind of information that seems to be done.
Yeah, and you know, have a disaster plan no matter what happens, right? If you get sick
Like
around the
anything
holidays,
else, right?
yeah,
A weather event.
you get sick around the holidays, know what to do. If you use insulin, just have a conversation with your provider or your educator. They're vast wealth of knowledge, but have a plan as to what to do. You know, sick day rules. How often should I be checking my blood sugars? What about my medications when I'm having nausea and vomiting and can't take any food? Should I be taking them? Not taking them? All these things have to be asked because it's your health.
Absolutely. Dr. Nunez, thank you so much for taking some time today. I appreciate you sharing this important information with our audience.
Thank you for the invite again.
All right, folks. This was the latest community conversation. We appreciate everybody joining us and talking about this really important issue that affects, as Dr. Nunez said, almost 60 million people in this country through either prediabetes or type 1 or type 2 diabetes. So it may not be you, but I bet you it's probably somebody you know. And so hopefully you heard a little something today that'll help you make a better decision about yourself and on their behalf as well. So again, Dr. Nunez, thank you so much. My name is Luke Margolis. Thank you for joining us here on Community Conversations at Atlantic Health System, and we will see you next time.
Be safe.